I mean, money is critical because that enables you to pay people and innovate. On the other hand, you can't go it alone. Diabetes is a complex disease, and you need to partner, and you need to have the mentorship of others.
Welcome to StartUp Health Now, the podcast where we celebrate the entrepreneurs and innovators reimagining the future of health. I'm your host, Logan Plaster. We've got a very special guest this week, David Weingard. All of our guests are special, of course, but David is unique. For years, we backed his work as a founder as he built up a startup called Cecelia Health, formerly known as Fit4D. This company provides a combination of high-tech and high-touch care for folks with diabetes. David built the company based on his own experiences managing type 1 diabetes, and he's been a tireless advocate for years for anyone struggling with the condition. But as great as that work has been, I wanted to invite him on the podcast because of a new initiative that he's leading here at StartUp Health. I'll let him explain the details, but the gist is that we've launched a dedicated health moonshot for the development of treatments and cures for type 1 diabetes, and David is coordinating the effort as Chief Impact Officer. He's already brought together an all-star team of T1D advocates and is making progress, uniting passionate impact investors with the entrepreneurs and researchers who are really building the future of health. As he'll explain, it's all about collaboration, about breaking down silos, speeding up innovation, and connecting research to commercialization. He'll also explain how you can join the effort. Stick around. David Weingard, it is a pleasure to have you with me for this episode of Startup Health Now.
Thanks, Logan. Great to be here.
I wanted to get you on the podcast and the YouTube show because of some recent news that you made in collaboration with Startup Health. You've moved to a new initiative that I think is fascinating. Initiate us to what this type 1 diabetes moonshot is.
Absolutely. And I'm incredibly excited to be doing this with Startup Health, launching the 13th moonshot around T1D, type 1 diabetes. So, as I lived with type 1 diabetes and I left Microsoft to found Cecelia, as you mentioned, and we've helped hundreds of thousands of people. At the end of the day, diabetes doesn't go away. People with type 1 diabetes and their families cope with it 24/7, whether they're in the mood for it or not. And there's a huge cost to our system when someone has a low blood sugar and they need medical support, or they need admission to the ER, or they have high blood sugars that result in the complications associated with diabetes, like cardiovascular or neuropathy, or feeling in the arms and legs, and blindness. There's huge cost to the system. So this is a big problem for roughly 2 million Americans and countless others around the world. And we need to further innovate, and we need to scale the work to prevent, manage, and cure diabetes. And that right now, the current state of the industry is you have pockets of nonprofits or industry, pharma, medical device companies all going at it more in silos. And the opportunity with the T1D moonshot with Startup Health is to leverage Startup Health's background in breaking down silos and bringing everybody together as one team to really help, and positively affect the outcome of T1D. One day we'll have a cure, and we need to work for it. But we also need a commercial ecosystem to support that research for a cure. And we also need to do the work to prevent and manage in the meantime. And we need to do it together.
The Health Moonshot rubric is something that Startup Health has used for many years, probably most of a decade. And I wonder if you could speak to, since we're at the beginning of this particular project, kind of what that concept, that metaphor means for the type 1 diabetes initiative. Why is a moonshot mindset? What are the aspects of that moonshot mindset, and why is that important to an initiative like this?
So the mindset of the moonshot is, when you go back to JFK's call to put an American on the moon and bring them back safely, involved hundreds of thousands of people to do that. And it took collaboration across everybody, all the different manufacturers and scientists to do that and accomplish that mission. Well, the T1D world, as I mentioned, is operating with a lot of different silos or groups. There are groups that are focusing on early stage research. There are groups that are focused on advanced science and molecular design. There are groups that are looking at how do you manage diabetes today and apply, smart insulins and intelligent devices to manage diabetes. And then there's a whole group that are focused on the prevention and science around that. And you have 10 or a dozen more, if I could keep going. And then you also have the global impact. We're not talking about the US, but what happens if innovation is happening in Brazil? Yeah. How do we bring that innovation to scale in Brazil and then bring it out to the rest of the world? India and China have some of the largest percentages of diabetes in the world. How do we affect those parts and other parts of the world as well? So the concept of the moonshot is let's bring everybody together. Let's bring the best innovation, collaboration, debate it out, invest in entrepreneurship, in leadership that have a transformative mindset, that are willing to go the distance to prevent, manage, and cure. And let's also make sure that everything we're doing is for the whole U.S. population. That's why we brought Sarah Altman's on, Chief Strategy Officer for Robinhood, to make sure that we're focused on the underserved part of the population. That, again, this is for the all access in the U.S. And then let's make sure we go global. And a lot of the thought leaders we have on the Impact Board have a lot of global experience as well, so that we could impact not only the U.S., but the world.
You mentioned the Impact Board, and I want to get into that because saying that you want to bring greater collaboration to something as expansive as type 1 diabetes sounds great, and breaking down silos could be seen as, marketing speak. What are the ways in which you're making this a reality? How do you really break down silos across industries, and how is the Impact Board a piece of that you just mentioned?
Right. Great question. So right now, if you're a scientist and you have a great, concept to advance the cure for T1D or help manage it, you have to pitch multiple grants to get funding and to cover your expenses to take this innovation to the next level. Well, imagine being part of the StartUp Health community and getting funding and peer networking and guidance on entrepreneurship and connections with folks in industry, that you can commercially scale your innovation and be guided to the things that are going to have the most impact. So that's one concrete way of breaking down the silos and reducing the dependence on, annual grants. Another part is, when I look at my own experience in founding Cecelia, I had to pitch hundreds of investors that may or may not have known what even diabetes was, to find the ones that invested in our Series A and B and onward. And imagine if the community is connected with investors who are already passionate about investing in T1D, and that's all made simple through the StartUp Health Moonshot. We can really accelerate a lot of entrepreneurship and advance the state of diabetes, which brings us into the Impact Board. So the Impact Board was selected, and we really attracted the people who have a personal passion for transforming the T1D landscape, but they also want to collaborate. And so David Panzera, who's trustee of the Helmsley Charitable Trust, who has been an evangelist for the T1D industry, and Helmsley has invested hundreds of millions of dollars in innovation, again, through grants, will continue to do it. And now they can partner with StartUp Health to help commercialize and scale the level of impact and entities. Robert Oringer, who's an entrepreneur and in industry, Mike Mason from Lilly, and a bunch of others, which we could get into, all have tremendous domain expertise to really help accelerate the moonshot.
David, what I find interesting about, someone like David Panzera, you just mentioned, from the Helmsley Charitable Trust, is that they've spent, you said, hundreds of millions of dollars in this arena, and yet money wasn't enough alone to unlock innovation. And that this collaboration piece is what I'm hearing you say is so important, that they're coming into this initiative and saying, look, there's a piece here. Maybe it's the entrepreneurs, maybe it's the startup investment landscapes. There's a piece here that still needs to be brought together, that just having one piece of the pie, whether it's the money or the great labs, isn't quite enough. Is that what I'm hearing?
Yeah, absolutely. I mean, money is critical because that enables you to pay people and innovate. On the other hand, you can't go it alone. Diabetes is a complex disease, and you need to partner, and you need to have the mentorship of others. And Helmsley, as an example, as well as the Juvenile Diabetes Research Foundation and the Diabetes Research Institute, have done amazing work funding and trying to make connections for companies that they fund. But at the end of the day, it's more one-off or a few at a time. On the other hand, StartUp Health has over 400 companies in its portfolio that have a network effect where they can collaborate and lean on each other's. And these are not only the CEOs, but the head of technology or the head of marketing, and an investor network, and a network of providers and health plans. You know, myself, I mean, I met our investors at a StartUp Health event. I met, health plans that became customers and distribution vehicles for us to reach T1D and type 2 people with diabetes through a StartUp Health event. I'm part of a monthly circle of CEOs that collaborate and support each other and help address challenges of the market and share peer support. And all that enables the entrepreneur to not feel alone and to really just quickly learn from others what they need to prioritize and where they need to just repeat something that's already been done, figure it out.
Okay, so that's the global concept for the moonshot itself, and you've outlined some of the members of the Impact Board. Let's get practical and talk about how people can engage with this moonshot. Let's say you're an investor, you're an entrepreneur. How can people get plugged in?
So the easiest way is there's an email address, T1D@startuphealth.com. So T1D for type 1 diabetes @startuphealth.com. Whether you're an entrepreneur, whether you're an investor, that's the one email to remember that will get the right people to respond to you and bring you in to the communication and share the content that's relevant. We are a lot of the way through our capital raise cycle. We have a closing the end of August. We have a closing the end of November. So if you're an investor who wants to allocate your capital around the social impact, and you're passionate about solving the diabetes, maybe you have a family member with type 1 or a friend, or you've seen the impact, in the community, let us know and we'll make sure to involve you there. If you're an entrepreneur, take a look at the materials we just published in a great StartUp Health article. We included a scorecard, which is essentially a blueprint that the Impact Board came up with for what are the things that we need to do and to transform the diabetes landscape. And look at what you're building, how it aligns with that scorecard. And if you feel the synergy, mention that in the email, and we'll have that conversation, because we want a call for innovation. We want all these great entrepreneurs and thought leaders who want to do something positive to come into the StartUp Health community and collaborate.
Is there a specific type of entrepreneur, a specific type of product that you're looking for, or is it a range of innovations?
Well, in the scorecard, we mentioned a few different things. So number one, this is focused on type 1 diabetes. We will have a type 2 diabetes moonshot later on, but this really has to be focused on T1D. So the patient is using insulin. It could benefit a type 2 using insulin as well, which is a quarter of the type 2 population. We're looking at solutions that solve for the whole person, for example, just the mechanics of diabetes is good, but it's more traditional. But transformative thinking looks at, okay, 40% of the people with type 1 diabetes have some form of stress and mental anxiety. So do you have something there? Do you have something around cardiovascular disease or obesity? Because believe it or not, over 95% of the people with type 1 diabetes have a comorbidity. So you're looking at the whole person. Do you have access to care? Is your solution available to everyone, even in a particular geography where you don't have to have it now, but will you plan and commit to expand and make it available? Those are some of the things that are in the scorecard, and certainly we could drill down on that. But the inside also, we want entrepreneurs who have the right mindset, that they're committed to really make a difference in the long term, and they're willing to plug away day in and day out to make this happen, and they're willing to collaborate with their peers and contribute and learn, together.
I'm so glad you mentioned the access issue, because I interviewed David Panzier from the Helmsley Trust, and he talked about how few people really globally have access to the gold standard for type 1 diabetes, to continuous glucose monitors. And so sometimes the innovation is some new tech, some great drug, artificial pancreas, whatever the next thing is going to be. And sometimes it's simply making sure that everyone has access to what we have now. Isn't that right?
Absolutely. And some of it is economics, and a lot of that sometimes can be guided, the patient to rebate programs from a pharmaceutical or medical device companies that people don't even know about, or through their pharmacy. And some of it involves, have we, translated the solution into the language that, Spanish, Chinese, Indian, whatever is needed, so that everybody can understand. Have we looked at the social engagement part? The foods that people eat affect diabetes tremendously. And so different ethnic groups eat different foods. So the solution really has to not only take care of the economic piece, but is it going to take care of engaging the people in a way that's effective and speaking their language?
Well, David, that's the time we have today. I really appreciate you explained to me what you're working on. I know we're in the early days of this. It's gathering steam quickly, but I know that there is a lot of news to come soon. And so I hope people who are listening to this, who are interested, will check back into StartUp Health and read more about the type 1 diabetes moonshot as it develops. And just to reiterate what you said a second ago, you said the best way to reach you was T1D at startuphealth.com. Is that right?
Absolutely. That's it. If you want to really create a moonshot around T1D diabetes, come and join us. Be part of the community.
And you're looking for investors, for entrepreneurs, but also collaborators, partners, just individuals as well?
Individuals, and it could be organizations like health plans that are looking to reduce the cost of, the T1D population, the number of hospital admissions as example, and they want to look for innovative solutions that are going to address that population, or provider groups that don't have access to endocrinologists, which is most of the country. How do they, whatever you need to solve for T1D, to invest and to accelerate innovation or to execute, just email us and we'll support.
David, it's awesome. Love what you're doing, and I can't wait to see how it develops over the rest of this year.
Thanks, Logan.
Take care. Be well.
Thanks for listening to StartUp Health Now. StartUp Health invests in health transformers around the world who are dedicated to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 400 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Impact Fund, go to healthmoonshots.com. Thanks for listening to StartUp Health Now. We'll be back again with another episode next week.